With the need for youth behavioral health services declining, the need for adult treatment reaches new levels. 23 News reporter Sydney Stoffregan talks to the leader of Rosecrance Health Network, who says its expansion of adult services is one step in the right direction.
Rosecrance ushers in a new era at its University Drive location, opening nearly 4 dozen beds for young adults facing behavioral troubles.
These are life-changing events for individuals.
Rosecrance's Griffin-Williamson campus expands resources for a growing number of young adults struggling with substance abuse and poor mental health. President and CEO David Gomel says the nonprofit's fundraising campaign has reached 80% of its goal of $750,000.
Tragic time in our society with overdose deaths occurring at unprecedented rates that we've ever experienced before, and we need to give people access to care. We know that this expansion is going to expand care.
30% of the expansion is complete thanks to $250,000 in funding provided by the state. State Senator Steve Stottleman says as a society, we are realizing the cost of leaving people untreated.
If there's not treatment or they don't have access to health care, the problems just get worse. From a personal standpoint and from a community standpoint, we need to make sure, one, people are aware of the issues, that they seek treatment and try to get help, and that there are resources to make sure that those treatment and services are available.
The expansion will convert several spaces into adult-friendly rooms, complete with day areas, a kitchen, and 40 private beds. Gomel says young adults are at most need for treatment services.
Sometimes people require to be away from their normal environment, an environment that's free of drugs and alcohol, that is intensively focused on their early stages in recovery, so they can leave residential and move and live a productive life.
The Griffin-Williamson campus has served over 15,000 youth in its 20-year service. Renovations for adult residency are expected to be complete in the coming months.
Thank you, Sydney. And the National Alliance on Mental Illness reports 1 in 5 adults in the U.S. experience mental illness each year, but less than half of those receive treatment.